My name is Ellen Poppett. I'm the Associate Director of the Illinois Heartland Library System, and I'd like to welcome all of you here this afternoon to our second breakout session, and this session is entitled COVID, Community, and Coping. We have wonderful panelists to join you today, and they are Maria Dent from the Mount Zion Public Library, John Howard from the Mahomet Public Library, Julie Jarman from the Staunton Public Library, and Kristi Lear from the Auburn Public Library. And this discussion for you today is going to be facilitated by Amy Byers, who's the director of the Chatham Area Public Library District. I know they will share tons of good information with you from their experience, and I'm sure you'll learn a lot, and I will monitor questions and share those questions with the panel. So thank you, all of you, and Amy, I'll turn it over to you.
Thank you, Ellen. Yeah, we're very excited to be here. First, I want to let our panelists introduce themselves a little bit more. So Maria, would you like to start?
I will. Okay, thanks, Amy. My name's Maria Dent. I'm at the Mount Zion District Library. I've been director here since 2009, so just a few years under the belt there. Our district size is just under 13,000, although I expect that to have grown once the 2020 census has come out. We're located southeast of Decatur, so we butt up right against Decatur, so we have quite a bit of crossover between Decatur Public and some of the other libraries and our library patrons as well. As far as COVID that hit us in March, we closed our doors March 16th. We started offering curbside service only May 18th. We opened our doors June 1st with reduced hours, somewhat reduced hours, and we've been open regular hours since August 3rd.
Great, thank you. John?
Hi, I'm John Howard from the Mahomet Public Library. Mahomet serves about 14,000 people in a fairly affluent community just outside of Champaign-Urbana. Although we're affluent, we also have the state's largest mobile home park in our district. We have our doors and our stacks open with slightly shortened hours. No meetings yet, but we are allowing individuals at our study tables, and we're still offering faxing and copying and notary. We do have 24-hour contactless pickup lockers, which have been an absolute godsend during the pandemic.
Great, thank you. Julie?
Hey everybody, I'm Julie Jarman from the Staunton Public Library. I've been director for about 10 years now. We are a small community, we're rural, we're about 30 minutes north of Edwardsville. 5,100 is our census from 2010. We don't know if that's going to go up or down, I suspect down. We were shut down in March like most everybody. We followed the governor's orders, of course. We opened up curbside in June. I was a little bit hesitant to go back full force, so we took our time and see how June went. We started in July and it's been okay, knock on wood. So yeah, we're okay. That's it.
Thank you. Kristi?
Hi, I am Kristi. I'm the director of the Auburn Public Library. We serve a community of roughly 4,700 people based on the last census. We're actually expecting that to probably go down with this one. And we are just south of Springfield. So we've got Springfield and then Chatham, and then Auburn is 8 miles south of Chatham. And we are primarily a rural community. We closed in March. We opened for curbside only service at the beginning of June. That went well. It was slow and steady. And so we were able to open the building and open the stacks at the middle end of June. But we have a limit of 20 people in the building, including staff, which has been really manageable. And then we're also continuing to offer curbside service.
Great, thank you. And as Kristi said, Chatham is not that far from Auburn. I'm the director there in Chatham. We serve a population probably with the census about 17,000 is my guess. We did go up. Well, we probably will go up. And we are right about 8 miles south of Springfield. So we're right between Auburn and Springfield. And we have we're currently in what we call a lobby and lab phase, which means that we haven't opened our stacks yet. So you can come into the building, you can get things at the desk, or you can go use the computers. Before that, we stayed in this phase for a while. Before that, we did curbside. Before that, we did the stay-at-home order like everybody else. So that's kind of gives a pretty good snapshot of Chatham. So thank you, everyone. And like Ellen said, we just have a couple of questions for everyone. And so here we are. First off, what lessons have you learned from that time of between April and June? What went well? What didn't work so well? Any feedback? How about Maria?
I'll just cover a couple of things that I wanted to highlight, which probably is kind of common sense, but it's good to hear common sense. One is we realized there was a need to have a plan. We have a disaster plan in place, but that didn't cover this type of situation. So we decided to go ahead and have a pandemic plan with the understanding that it can change depending on when none of us have crystal balls. So that was one thing that we learned, that we needed that, and we very quickly formulated that. The other, of course, was clear and frequent communication. That was key during the whole time with staff, with the board, with my library board, and with the community, because the community wondered what was going on, all the time, and also to stay relevant. So we wanted to let them know constantly what we were doing or not doing, what we could, the next step. So that communication and a plan are my two things.
Thank you. John?
To unmute my mic. The biggest thing I learned, I think, during that time period was to over communicate, especially with staff. During March through June, we were having full staff meetings on Zoom every 2 weeks. And even that was probably not enough. Every time I wrote a plan, I would take it by the staff, and the staff would help me change it, almost always for the better. And so that was a big thing, working with staff. We learned that if you want patrons to comply with your safety procedures, you need to be consistent and you need to be firm. We set up a station by our front door. You can't walk into our library without going by our greeter station, and the greeter makes sure that you have a mask on and that you use hand sanitizer or wash your hands, which is why we feel comfortable letting people in our stacks, because we know that everyone's been sanitized as they came in. We were one of the first libraries to open in the state, apparently after Maria by 7 days. And we have had almost no problems with people with complying with the safety things, almost like very close to zero. Not zero, obviously, but close to zero. Now, one thing I think we could have done better is communicating with the public. I needed to stop being cheap, and I needed to buy big signs with our hours and our services and things and put them on the front doors where people could see them instead of trying to do everything on the copier. And so I've learned that lesson. One other thing that we did well that I think it was really helpful and it continues to help us right now is that our library board passed a temporary COVID-19 safety policy. And the policy did not allow the staff to make exceptions. And that was how I asked it, because they almost always will give the director ability to make exceptions. But I said we didn't want to. So when people want to come in and argue about masks or argue about anything, we simply tell them our board of trustees passed a policy. We don't have the authority to give you permission not to wear a mask in the library. And then, of course, then we accommodate them in some ways. But honestly, not arguing with people on the merits of masks, but really just saying, look, this is our policy, we can't do anything about it, has really saved the library from having to get into some of those awful conversations, and has been something that I really like. I will say that after saying all this, I realized that I need to be communicating with my staff better now in this current time frame. And so hopefully I'll continue to learn that lesson.
Thank you. Julie?
Get that mute button, unmute. Okay, yeah, we kind of did the similar thing as Maria and John. With the disaster plan, this was all new to us. And John with the mask, we were the same way. It's a policy. This is what we're doing. It's not our choice. Although I definitely think we should wear a mask, but the thing I learned the most was looking outside the box, getting out of my comfort zone. We started all kinds of programs after this all hit. I was in a rut. I was just going to work, like in a dream state almost back then, and just didn't realize, things could be a lot better. And so we've started like online story time. We did newspaper articles, Facebook, which we did newspaper articles and Facebook, but not enough. So we started working on that. I love my online storyline. I'm still doing that. I'm looking at my notes here to see. So yeah, I think we just, once I got on my comfort level and tried different things and listened to my staff and relied on the library board, which was very helpful to me. I have a medical doctor on the team, and I also have 2 teachers, so, and a lot of other business people as well. So a lot of great output there, insights, so yeah, I think that was it. Just be creative, just try new things, and see, and don't rely so heavily on myself. It was a team. So I think that's the main thing I learned.
I think that's great. Yeah, team's important.
Yeah, so for me, the struggle at the beginning of this was having to make decisions quickly, for a situation that I never would have even imagined that I would need to be dealing with. Are we essential? Can I have staff in the building, or does everybody have to be home? Are we going to quarantine materials? How long? And all of that. And so that was, now we have a plan, even though it's a plan that we know has to be flexible, because there's still a lot of unknowns. Still having some sort of plan is a lot more reassuring going forward. And then another thing that I learned right away when we were under the stay-at-home order is that working from home does not mean working 24/7. So I actually created a Google sheet for like punching in and punching out, so that like even if nobody ever sees it, I'm going in there and punching out. Now my time working is done, and I need to step away, and then being able to share that with my staff and make sure that they weren't falling into the same pitfall that I did. But I know that one of the silver linings that my staff and I found with everything was just a real emphasis on getting the library outside of the 4 walls and taking the library to our patrons. And the biggest example of that is the effect that it had on our summer reading program. We took turns doing Facebook Live story time, so everybody in the building spaces were getting out there and still seen. And then we had different members of the community record story times that we put on Facebook and on our website. So we had the mayor do a story time. We had some aldermen. We had a firefighter in like full uniform record a story time for us. The school district librarian recorded a story time for us. Some of my trustees did. And so it really fostered a lot more community participation in our summer reading program that we had before. And so, yeah, that was a really good silver lining that we found.
Excellent. Thank you. I will say that we had the fire department do story times as well. So we had a story time where a firefighter read a story to another firefighter who was in his bed with the blanket up. It was the cutest thing ever. Oh my gosh. But for here in Chatham, it was really difficult for me because I'm a planner, right? So as soon as this all happened, I realized I didn't have a pandemic policy. It was not part of our disaster plan. And so I created one. And then as a week or 2 went by, I realized, well, that's not gonna cut it. We need a lot more to figure out. And in trying to figure out our next steps and how we're going to, how we were going to move forward, the main thing that I kept reminding myself is my staff is the important part, right? So as long as I'm keeping them safe and keeping them in communication, as others have said, I'm going to feel good about what decisions I'm making. And like Kristi said, very quickly making those decisions, right? So just keeping them in mind really helped drive what we ended up doing. And I agree, the creativity that has come out of all of this and having the staff be part of that creativity time to really say, okay, well, our doors aren't open. What does that mean? Okay, here's how we're going to knock that out. Here's how we're going to tell people. Here's how we're going to do all these things. My favorite thing we did very quickly was we had the digital sign up for library cards, because we didn't want those people to be without digital resources during this time, right? So we wiped off fines. We did whatever we could to make sure they had access. And that was a really, really great thing, I think. One thing that we also did during this time was we tried to figure out what we could be doing with our time. Once we were able to come back into the building, staff that is, we decided, you know what, now's the time. We're never going to have this moment, hopefully, again. So let's do the things we've always wanted to do. And one of the big things that we wanted to do was completely reorganize our shelving. So we took a couple of months and completely redesigned children's and several other areas in our building, where if we had a bunch of patrons in the way, it would have been an ADA nightmare, to be frank with you, but it would have taken forever, right? But we were able to focus on something that we could see positive change right then. And that it was so good to have that building of camaraderie with staff, right? So it was great. One thing that I think it would have been nice if we had done differently is, as I said in the beginning, we are still in the lobby and lab phase, where a lot of people went into the opening the stacks. We deviated, and so that made it a lot harder for myself and our board to really know when to change. And so when that change was finally decided, well, then all the mitigation things that we're currently facing right now has been taking place. So it kind of made us kind of go off the rail a little bit, and kind of trudge our own path, which made it a little bit difficult for us to really know where to go next. So that's us, but you live and learn. Hopefully we don't have to keep this information in our heads forever. Okay, so next question. What resources or support did you have or are you using to go through this time? For us, one of the things that we developed very quickly in Sangamon County was hopefully I'm not talking for Kristi too, because she's part of that group. We gathered all the librarians in our county together to have conversations within our county, right? Because everything was so new. And as you heard from before, we all were looking at different information and how we could all work together. But our county librarians are really the ones that I leaned on to hear what they were doing. And even if we weren't doing exactly the same thing, knowing what other libraries in our area were what's doing, it helped define how we wanted to move forward. So I really appreciate those within our area. And also we just, I'm part of a group with our local officials, our school district, our fire, police, and mayor, and churches that talk every other week about what's going on in our community. So we're hyper localized what's happening in our area, which has been very helpful too. So connecting with our community leaders in that way, knowing what they're doing, knowing what the schools are doing, maybe a little bit before the public knows, helped again define how we were going to move forward. So those are the best resources that I got to use, really librarians that I know and trust, and our community members. So Kristi, do you have anything to add to that?
No, just kind of piggybacking on that. Yeah. So what I had is the resource that I turned to was my community of other library directors and librarians, and just how nice it was that we were all coming together, whether it was, the directors chat that were being put together, or there were, email threads with the listserv, the directors listserv that was going on, and the email threads with the other directors in Sangamon County was huge, or just like phone calls with other library directors. You're like, I'm so burned out. But just having that community of support and resource sharing. We have our reopening matrix that we put together, but that was not solely done by me. Another library director put that out there. And so I was able to just take a look at what she had already done and modify it for my library, instead of having to not even reinvent the wheel. I mean, at this point, we were just inventing the wheel. And so, yeah, just to have, all of the communication and the resource sharing and the support of the other library directors and my peers was, I mean, that was the top resource that I went to.
Absolutely. Good points. Thank you. So next question, how do you keep staff morale up while also supporting your own mental health needs? John, would you like to take this one?
I'm first, right? Okay, yeah.
Whatever.
No.
Maria first, sure. Go
I'm
ahead.
sorry, you cut out, so I couldn't hear.
Go ahead, Maria.
Oh, okay, all right. And, you know, I think, again, some of this is common sense, but I think in working with the staff during such an unknown time, the main part was communication. And we've already mentioned that. Making sure, one thing, making sure staff knows exactly what is going on, making sure that they know that they are valued and that decisions being made include them, and that foremost is not just their physical health, to stay away from this terrible virus, but also their emotional, mental, and their financial health, because all of us, have that concern too. So I kind of started with not just me, but I personally did start with the premise that there's so much unknown. So what can we have that is known? So part of that was made possible, obviously, by a very supportive library board. But I wanted staff not to wonder, not to say, well, are we going to go back to work? What's going to happen? Are we going to get paid? So it again, communication. It may not be what they want to hear, but at least you give the facts and you say, this is the situation, and you move forward from there. We were very fortunate. We all stayed employed. And that was a big reassurance for, our staff, which was wonderful that we were able to do that. Once we reopened, I think the staff was able to see all the precautions that were set in place, and they were all part of it because we talked all the time, and they saw that during our closure, we were buying PPE. I'm sure everyone was kind of in the same boat initially. It was very hard to find a lot of times. So, we scrambled, sometimes paying exorbitant prices for some things, but, the plexiglass, how we were going to have everything set up for when we did let the public in, the cleaning supplies, the gloves, the masks, the hand sanitizer. I think they understood that the library valued them, not only, of course, the community, but the staff as well. The other part of it was making them responsible and owning part of it. Decisions were made with their consideration, their suggestions, but also with their participation in keeping the workplace safe. So it's not that you walk in and you're not, you are part of it. You are part of keeping your space safe as well. And I think that has helped a lot for us to come together. And again, like I said earlier, communication, listening to suggestions, concerns. Some of my staff, they're the main frontline people. If they make a suggestion, it's usually based on an experience of some sort. And then, we embrace that and we move forward. So it's another way of just knowing that we're in this together.
Excellent. Thank you. John?
So I think it's important that we not minimize how darn hard it is for people to manage just emotionally in this situation. In my own life, personally, there are two things that keep me sane and help me manage my life, and that is deadlines and routines. And in April and March, I didn't have either of those things. I'm not sure I descended into full-blown depression, but I will tell you that I was very close. It was hard. Some days I could barely drag myself out of bed. And I remember one week we had a leadership team meeting. Now this is during the closed time when we were all staying at home. We had a leadership team meeting on Monday, and nobody heard from me for days after that. And I started getting emails on Thursday saying, John, are you okay? You're not dead, are you? Right? So, each one of us is just dealing with this differently. And I think we have to give each other a lot of grace. We have to be patient with each other. We had the equivalent of a Zoom fist fight at one of my staff meetings. And both people came back and apologized because they were just also stressed out. So I think it's key that we really give each other a lot of grace, a lot of forgiveness during this time period, and realize that everyone's just managing as best they can. When we began to come in to fill lockers and answer phones in May, I spoke personally with every single member of my staff to see how they were doing, but also to gauge how comfortable they felt about coming back to work. I'm still trying to do that every couple of weeks and make sure I'm really touching base with people on a regular basis. I'm not treating all my staff the same. I can't. I'm trying to meet each person where they are and find ways to allow them to do their job as best they can, with their own personal situation. We have some staff who only feel safe working behind the plexiglass at the circ desk, and we have staff who are willing to do anything that's needed, be a greeter, be a floater, whatever. And so as each situation changes, we just try to change again. Things are flexible. We're moving a lot. One real practical thing I've done is to increase the amount of chocolate available at the library. America may run on Dunkin', but libraries run on chocolate. One final thing I will say about this is, if you are here, you're not the director of your library, and if your director is doing a good job, please let them know. Please show some appreciation to them. We are dealing with things as directors that none of us were trained to deal with. And we worry all the time that we're doing it well. And so just knowing that your staff supports you is huge. So if you're not a director, please let your director know they're going to do a good job. It goes a long way. So that's what I got.
Thank you so much for that. And I think you've come up with the quote of the day, is librarians run on chocolate. So thank you for that. Julie?
We have a chocolate drawer. I think it's empty now, but I need to restock. It's a great suggestion. We've used it before, but this is probably one of the hardest that we've had to deal with, morale for everybody, because it's hard to stay up. It's not been easy. There's no doubt. I mean, wherever you feel, whatever spectrum of the political situation you're on, it is not easy for anybody. So I think we need to recognize that. The first day that I walked into the library and it was empty, I was the only one that was allowed in the building to do the book drops. Everybody else was working from home. I took a picture of my desk. My office the light was on, but everything else was dark. And I sent it to my staff. I miss you all, hope everybody's doing okay. And so it's been tough. And when I had to box up the toys, when we started open, I cried when I had to put that train set away, because I love that train set. I set that train set every day. And if it got messed up, I'd be fixing it. So, but we have to get up. We can't be down. We have to stay up. And so the things that we did was communication with the staff and the library board. We had so many discussions going on with the emails and the texting. We started doing Zoom meetings on Fridays with the staff, and they turned out to be cocktail parties, but we were all home and I figured it was okay. We needed a little release. Nobody got silly, but I think was able to relax and make sure we could see people. We could see that they were okay. I texted the staff all the time, emailed, called, whatever. They did the same for me. Yeah, it was tough, but we got through, and thank the Lord. So now now that we're open, trying to communicate with them, and I'm trying to tell myself I'm not God, I'm a director, and it's not, I don't have to take everybody's problems, but I'm here, and they're, surely they're giving me that too. So we sit and talk a lot more. I have a rocking chair now in the circulation area. We have the desk chairs, and then I have the rocking chair, and it's 6 feet apart, of course. We had that rocking chair in the children's room. We moved it when we opened. So I sit in that rocking chair and we just talk with everybody. How you doing? What's going on? We're flexible. We've had a few situations where people had to be out for a while. Everybody else chipped in. It's so important, this morale, to stay up. You have to stay up. You have to look for hope. You have to look for the bright things, because it could be so easy to go the other way. So we're just doing the best we can. Glad that we have each other. So yeah, you don't want to be isolated in this time. And it was hard. It's been hard. So anyway, yeah, we keep going. So We're still doing all kinds of fun things. We're doing projects. I think Maria said that or maybe it was Amy. I'm sorry, I don't remember, but we're doing different projects. You're all doing a great job, but we're doing different projects to keep, and everybody's involved and everybody feels like they're contributing. And I also, every time we did a plan, I talked with the staff. We talked to the board. Everybody bought into it. Everybody, the mask situation, we all had to enforce that. Everybody had to equally enforce it. But we do it in a way that, that's the policy of the library. Sorry, you can't come in without your mask, but we'll serve you at the curbside if you prefer. It's, a gentler, kinder world right now. So we're getting through it. Thank the Lord. So.
Thank you. And I just think that if we all can give ourselves grace as much as we give others, it'll all be okay, right? Because I think, I hear a lot of stories and a lot of what other people are going through, and it's a lot of emotional weight, that sometimes it gets placed on those in leadership. So giving grace to yourself and saying it's okay to take your own time is really important. So thank you all for that good conversation. The next question is, do you have any plans or policies that you felt were helpful in moving forward during this pandemic? And I'll start. As I said before, I created a pandemic plan like the week we all started shutting down, and realized that was definitely not sufficient at the time. And as Kristi said, I took a similar approach where I found someone else, Clinton, gave a wonderful rubric to kind of start this process of what was going to stay open and closed and how that was all going to work. Once we kind of moved into that, I created a proper plan of what we would do at each level of back to reopening. So the board can understand what would be open at each stage and what would not be and how that process would go. That sheet actually needs to be updated because with these tiers of mitigation coming in that was not planned back in, June, that plan that I put together needs to be updated now. So it's not going to end, right? We still need to kind of continue to make sure what we did back in the summer makes sense in the fall, it will make sense in the winter. So we have to continually update those things. The other plan that I put together was kind of what John was saying. Really, I took all of our HR policies and created a COVID-19 HR policy manual that had everything in it. When Maria was talking about financials and things like that for the staff, I wanted to make sure they knew exactly what the board has been saying over the time, right? So if it was, we're going to pay you if you're in the building or not the building, we want to make sure that's very, very clear. What does remote work look like? What does all the new policies with FMLA and the sick leave, those things were in that document, as well as really just anything. We normally our vacations, you can't take them after at the end of our fiscal year. They go, anything left over goes away. So the board said you can use them up until December of this year. So they actually extended our vacations. I wanted to make sure all of that stuff was very clear for the staff, so they had a place to go where they could find that information instead of me just sending them emails every now and again saying, hey, here's a new thing. So those were the big things that I did. But again, I think all could use another review to make sure that this next stage we're more prepared for as we go on. So the other thing I did, back to the plan of stages, I took all that information that we've used in the past. So press releases, graphics, any type of procedures for curbside or for we were working from home, like the Google form for taking care of personnel and time keeping. All of that stuff is all in one document. So if we do revert back to a curbside or stay-at-home model, I have all that information from back in the summer or back whenever, so I can pull that, update it, and it's ready to go instead of having to find it at that time because it was such a scattered time. So hopefully we don't need it, but it sounds like we might just be going in that direction. So preparing as much as we can with the little unknown that we have, or little known that we have, is kind of what I've tried to do as we move forward. Maria, would you like to add anything?
I'm going to just add, again, continuing what you just said, the importance of having something like that in place. And you were very thorough, which was wonderful, because I think most of us going into this thought, okay, let's get through this. Now we can go on to the next phase and the next step and the next step. Not thinking, oh my gosh, we may be going backwards again. So not having to reinvent the wheel by keeping all that. And we're a little more prepared this time. We were all thrown into it mid-March. We went from regular, everything's normal to, oh my gosh, our doors are shut. So for most of us. So, we don't want that again, obviously, and we shouldn't have that again if we are trying to plan ahead as we're going. So having a pandemic policy, again, like I mentioned, that is somewhat flexible, right? Because we don't know some things, but at least that serves as a guide. So we're not just starting from scratch. The other thing that during this time that I found very helpful for our library, we are a district library. So for those of you that are district libraries, you know that you have the various levy funds. We institute a risk management policy, something I stole from somewhere else, but with our lawyer's blessing. So it actually outlines how much of everyone's salary can be paid out of our liability fund, our liability insurance fund. That has helped alleviate some of our, corporate account amount, so that because everyone is cleaning, everyone's looking out for the health and well-being of staff and patrons. So we were able to take some of those funds and actually pay a small percentage of everyone's salary out of that. So I found that helpful for us. So I don't know if it would be helpful for any other library. So that's what I have.
I'm sure it is. Thank you very much. And now on to our last question. At the beginning, we talked about what we had done prior. Now let's talk about for the next 3 to 6 months, or even in the future beyond that, what are some positive steps we can take in order to move our libraries forward with the focus on that future? I'm going to ask Maria, do you want to keep going?
Okay, just because I'm sure everyone else will follow and add great things to this. Again, the main thing is learn from what we've come through so far. Take the positive and the negative, and let's just keep going. One of the main things, because this has just been very helpful throughout all this, is talk to each other, talk to other libraries. None of us need to feel that we're alone in this, because we're not. And, if it works for us, it could work for other libraries. So share those ideas. Librarians, we're well known for sharing. We call it stealing, but really we're borrowing, we're sharing. That's one of our strong suits. So we are very creative, with all the programming ideas that people have come up with. It's not just us. Reach out, ask people, what have you done for adults? What are you trying, what other virtual things? Talk to each other, get on the listservs, the directors chat, your area. Everyone mentioned, talking with area libraries. You don't want to be the last library to do something if everyone else around you is, but if it doesn't work for your community, it's okay to be the last or the first. And we need to accept that. But the only way we're going to find out is if we talk to each other.
Excellent. Thank you very much. John?
All right, well, I have my staff brainstorming ways that we can clean up and improve the collection, especially if we end up having to close our doors to the public again.
Mm-hmm.
We didn't get some of that stuff done in the spring that I'd love to. So if we do end up closing to the public, but we're allowed to have the staff come into the library, we're going to do the first full inventory we've done in years. We're talking about possibly doing a diversity audit, finishing up some genre label club projects we have going. And we're also started planning an exciting new project where we're planning to move a portion of our collection off-site into off-site storage to make the remaining collection more browsable and attractive. So if you know of libraries that have done really neat things with how they're displaying their collection and how their signage is and things, please let me know who I should be talking to, or say in the chat if you know that. Because we've got right now a situation where our shelves are packed full of books, and it's not good for circulation, and it's not attractive or interesting for people to browse. And so we've got a whole plan that we're putting together that would be perfect to do if we had to be closed for hopefully no more than 4 or 6 more weeks as we were in the spring. So that's what we're looking to try to move things forward with, so that maybe when the patrons come back in the library, they'll see a slightly nicer library than what they left.
Well, thank you. And I'm sure that the system is already talking to you about a webinar on when that's over. We want to know how that all goes. So yeah, we're stealing from you. So thank you. Julie?
All right. Yes, we are going to continue to look outside the box. We're going to keep doing some of the things that we started, that we've learned from, that we enjoy. Online story time will continue. And I have to say that I got that idea from other directors who were very, very, very helpful to get me going, because I am not a tech person. I couldn't even tape a darn thing back in March. I figured it out pretty quickly, but I had a lot of help. So we're going to keep doing that. Better communication with our staff and with our library list. We have young adult book club that we send care packages to maybe every 6 weeks. And I think that's going really well. We do a story time thing. We send them things in the mail too. And we tell them when we have grab bags to come in. So that's working well. That's new since March. The best thing that I think that we have done is before this all started, maybe, way back, when we can think that far back, February, we used to have 2 entrances into the library, the front door and then this back door, which was hidden. You could come in the back door, past our conference room, but we couldn't see you from the desk. And we could hear a door. We're like, well, who is that? So when we opened in June for curbside, we locked all the doors and we had to monitor. And then in July, we left that back door locked and we opened that front door. And we have a table there and we're right there. We make sure you have your mask on. We put a doorbell in the back door. So if people were having trouble walking to the front, it can be a lot of steps, and there's a parking lot back there. So we've given them the option, just ring the doorbell. We will come check. If you have your mask on, we will let you in. There's glass doors back there. If you don't have your mask on, we'll do curbside. So we feel more secure. We feel like we're more control of the situation, especially in this health pandemic. And I'm expecting us to keep that. I like us having that one door. We can see them come in. We know what they're up to, so that's the main thing. But I will say the director's chat as well. I was always off on those director's chats. It was always Thursday. So I've changed my schedule around and I'm learning so much from director's chat. So I will continue to do those as well. So yeah, we're just living outside the box.
Absolutely. Thank you. Kristi?
Yeah, I think it's just an emphasis on taking it one day at a time. We've got our reopening matrix that works backwards and forwards, and just following that, updating it is needed. Like we just started updating it, trying to figure out where the different tiers of mitigation fit into that. And then I know that if the building closes again, the plan is projects, particularly so. My community, a good portion of it is not online. And so if all of our focus is on digital access and doing things on Facebook, it's not reaching a good portion of my community. And so when we were closed before and if we were to close again, a big emphasis is just making sure that we're doing projects that are really obvious when you come inside. When we were closed the first time, we did updated signage throughout the library, kind of worked on branding and using like unified colors and things like that. And so we know we want to do that. So we've got projects for moving things around. Just doing whatever we can, projects that we can, that when the patrons come back inside the building, they can just quickly and visually see the work that staff was doing if we were to close again.
Good idea.
Excellent, thank you. And for us in Chatham, back in February, we were really close to finishing our strategic plan. We were really close. And then all of this happened. And honestly, we haven't brought it back up again because the world has changed, right? And so what we talked about in February might have been really great, but is it the focus that we need to have right now. So two of our wonderful librarians are actually going to be talking to people. We're calling it community conversations, where they'll call someone, they'll do like a Zoom call, and essentially just ask them several questions, a couple questions, I shouldn't say, kind of about how's it going, trying to get more feedback of the now. And so when we continue to move forward, we're gaining that information, and hopefully we'll be able to translate that into service, into programming, into collection, because we're listening to what the needs are right now and not what pre-COVID was, because there are going to be different needs. And we want to make sure that we're representing our community in the best way we can, and still staying that relevancy that we talked about too, right? So we want to be on the cusp of that, not just back steps, a couple steps. So I'm hopeful. I think it's a wonderful idea, and I think it's going to be great to keep those lines of communications open with our community as we move forward. So that's what we're doing. I'm excited about it. We'll see how it goes, but we're just starting, so we'll see. With that, we are done with our question portion of the meeting, and now we're on to more questions. I guess Q&A. With anyone who would like to ask us any questions, we're on it.
Amy, I can report out on the chat.
Great.
Lots of people have asked for you to share your pandemic plans. So I'll be reaching out to each of you after this, and we can get those up on the Member Day website. And that's where all the handouts and follow-up information from this day will be stored. People have shared doing adult and teen programming, doing weeding projects during the shutdown. But three crucial points that have come up, and we could sit here with a cup of coffee for the rest of the afternoon and talk about them. So I'll give them to you, and you can discuss them among yourselves. One was, and this was a great question, during the stay-at-home order, staff needed support at home. So there was staff that was home that didn't have reliable internet access or didn't have a laptop to use. And so what kind of support might you have provided to those people? Or what did you have for them to keep them? And I remember from a lot of directors' chats, people talked about what work they provided for their staff to do at home. So maybe that's the question.
And we sent Baker and Taylor boxes home with multiple employees, and they came back with all the processing done on them. So that was one thing that you could do. The catalogers both had internet access, and a lot of cataloging got done from home, but we also got all the processing done. Literally, people come in and pick up a couple boxes and some labels and take them home and bring them back. So that was one thing we did.
This is Maria. I'd like to share one thing, which I wanted to mention earlier. Our staff size is, we have 5 full-time and 4 to 5 part-time, depending on the time of the year. But one thing that, again, I learned through this is the importance of cross-training, because we do have some staff that is mainly desk, but they've also learned how to, before COVID, so I was blessed, cover and process books, not do the actual like records creation, but the covering, the labeling, all that. And so I was able to give part-time staff work to do at home as well. We sent laptops home with staff. We have hotspots, so if they didn't have a good internet connection or didn't have internet at all, some of my staff does not, we were able to do that. So we kept people busy. I had staff, they would call me at home going, what can I be doing? I need to be doing something. Tell me what to do. So if we couldn't be in the building, they were able to stop in, grab the stuff, and work on it at home. So cross-training is really, really important, I feel, where it's, applicable.
I think I'm on. I just want to say that one of our barcoders, she was climbing the walls at home. So we she learned how to barcode through Leap. And Illinois Heartland, they were very helpful. She was thrilled. They got her through. We got a lot of work done when she was at home doing Leap. So we are very appreciative of Illinois Heartland and all their efforts. So that's one thing that helped her, but we were all doing training videos. We all were. I mean, I was going in and I had plenty to do, but they were all working on other things because we were all getting paid and we wanted to work. So that's one thing that we did. So
We were like Maria. We said, I said to people, what do you need? You need a laptop? What do you need? And we actually had someone who was pregnant. And I said, do you want a better chair to take home with you? Take the chair. I don't really care, whatever makes you more comfortable at home. I definitely took my monitor at home because it's just like, it's a better setup, right? Whatever it takes to get things done. But let's see, what else? We did a lot of the things that we were talked about, obviously a lot of training, but that's all internet based mostly. We also worked on a lot of craft type things, right? So anything to help children's because summer reading was looming. So a lot of reading type prep was also big for us as well. But yeah, we took a lot of things out of this building very quickly. It all came back, I promise.
Juliet had a question about masks. And if you look over in the chat, I think Monica Cameron gave her a really good answer that boiled down to be firm and consistent when reminding people that masks need to be worn both over your mouth and your nose. But the last question is probably a good one to finish the discussion on. And it just basically said, what are your thoughts for your library as we look at these new mitigation efforts? And what do you see might be in the cards for us? And the biggest question was going back to curbside.
Well, if we go back to curbside, well, it's not curbside for us. We use our pickup lockers, but it probably won't be until tier 3 mitigation.
Same.
We've created such a good infrastructure of safety here at the library. I think the staff feels pretty comfortable that, even through tier 2, that we can continue to keep our doors open. A big piece for us is going to be the willingness of staff to come in. If I do have high risk staff members, and if they're feeling uncomfortable with coming in, we may need to limit hours, cut back hours. And then in tier 3, we're really going to be looking at the local situation on the ground. Not just how is our region doing, but how is Mahomet doing? How is Champaign County doing when we make the decision to whether we actually close our doors, shorten hours, or stay open the way we are right now. Because it's very possible the region can be doing poorly, but your region, your local town and county are doing much better than that. So that's kind of where we're at. I don't think we're even going to consider closing doors. Our board had a great discussion the other night about, are we essential? And our conclusion is basically that for the mental health of our community, especially in the wintertime, when there's so little to do, that being able to get library materials to people, it really does, we feel, make us essential.
Yeah, we're going to stay put where we are right now for tier 1 and tier 2. I think we'll just probably be about the same as well. Tier 3, we haven't discussed yet. I'm trying not to go curbside if I can prevent it, just because it's going to get cold. It's going to get dark. So if I can keep my lobby open, which the way that my building works is you walk in and the circ desk is right there. You don't have to walk several feet, really. It's very close. So hopefully if I can keep the lobby open in that capacity, then I'm hoping to just keep it that way and not go to curbside. But again, I'm with John. We'll see what happens and kind of how it all is going to play out in our area. Right now, our Springfield area is not great. So it might mean that we're not great. So we'll see how it all shakes out.
Yeah, I know. I can say, so we have a really small staff. We only have a staff of 3. The capacity in our building is already only 20, including staff. And so if we were to have to limit that any further, we're really looking at going back to curbside service. We're right now, we're really on the precipice of that, because if we were to ever on a regular basis come close to being at capacity, we don't have enough staff to have somebody stationed at the door and counting people as they come in, or trying to have people queue up outside the building, waiting for, other people to leave to come back in. And so right now, given what our limitations are, I think that we're probably looking at curbside service for tier 2. But I mean, it's not decided. My board's meeting next week, so we'll be talking about it then. Just kind of figuring out what makes sense for us.
Sarah Zumwalt just typed in the chat, and Sarah's the director of the Litchfield Public Library, and their library is currently open with no restrictions. And she just wanted to know if anybody else was open to that extent. And if you are, just put it in the chat. Bill Wagner said he expanded the Wi-Fi capabilities to include an extended area into the parking lot. This can be switched on and off as needed. And we've seen a lot of that happen with our libraries from probably the 1st of April on. People are still looking into providing that service to their communities. John, do you want to talk about what you're doing in your parking lot?
It's surprisingly cheap to get a Wi-Fi access point that actually covers our parking lot really, really well. I want to say we paid less than $200 for the piece of equipment. And it was, I had an internal staff member who was able to set it up. So you don't think it's going to be crazy expensive to make that, and it's better than nothing for people who have no access to the computers or the internet. It's not great to have to sit in your car, but it's better than nothing. So we have a stack of about 10 laptops that were given to us by State Farm maybe 5 years ago, and they still work. They're not great, but they work, and we're taking about half of those and getting those set up to circulate in case we have to close. It's just another way to provide internet access to someone who doesn't have it.
Thanks, John. It is 2:12. Any closing statements from any of you? Closing thoughts or things we didn't say that should have been said?
This is Marion, and I would like to make a comment if I can and say thank you. This was very informative. And thanks for admitting to the mental anguish. You feel like you're alone when you have that breakdown moment. No, thank you. It was very informative.
Just keep the faith out there. We're doing God's work, and we are essential to our communities. And so I think it's important that, all of us just keep plugging along. We will get back to normal someday, I think.
Well said.
That being said, I think we can first of all, say a big thank you to all of you. COVID interrupted the planning of this event, and so we had to retweak a couple of times. Julie and Maria were kind enough to join our group, and we so appreciate all your contributions, as well as the contributions from John and Kristi and Amy. So thank you, all of you, and we move on to the closing session, and that is Brooke Dean, who's going to talk about creating pathways to civil legal justice and how our libraries can help patrons do exactly that. And here's the teaser. Here's what she told me as she was preparing, because she's in Seattle, but she really wanted to make it Illinois appropriate and Illinois meaningful. She said, we have a treasure of legal resources in Illinois. So I'm excited to hear what she says. Julie, Kristi, John, Maria, and Amy, thank you so much today. We really appreciate all your help.
Thank you, Ellen. Thank you, everyone who listened.
Thanks, everybody.
Bye-bye.
Bye.